So this is one exercise every female should know and do in her life. So that is Kegels exercise. Hi, I'm Dr. Shruti, a fertility specialist and a cosmetic gynecologist working at Dewsculp Aesthetic Clinic, Mangalore and Kaningad. So today I'll be giving a little bit of information about Kegels exercise. So I am sure most of you do have concerns about getting fit and going to gym and exercising. All of you are concentrating on all of your muscles like hands, thighs, abdominals, glutes and everything. But you always forget about perineal muscles. So we do get patients who are into gymming and toning their body, but they often come in complaints of dribbling or leakage of urine when they're doing their exercises. That's because your whole body is stressing out and the whole stress is falling on your perineal muscles. But those perineal muscles also needs exercise, and that best exercise for your perineal muscle is Kegels exercise. There are several benefits of Kegels exercise, and the main three benefits being prevention and treatment for leakage of urine. That's what we call as stress urinary incontinence. I do get patients in my OPD who are very much concentrated on gymming and exercising and toning their body, but often they come to me with complaints of leakage of urine. Unmarried, non-delivered, but still they have leakage of urine. See, we have to know that leakage of urine usually starts like post-delivery or towards their perimenopausal, menopausal age group. So once young females started getting it just because they are over-exercising other parts of their muscles but less concentrating on their perineal muscles. So that's the importance of Kegels exercise, that it prevents and also treats stress urinary incontinence or leakage of urine. So the second benefit of Kegels exercise being the paravaginal muscles and the perianal muscle tightening or strengthening. So this helps in vaginal tightening and also to a certain extent prevention of hemorrhoids. The second benefit being the perineal muscles, when it getting tightened, the paravaginal muscles are getting tightened. So it has a major role in vaginal tightening, non-surgical vaginal tightening. The first treatment what we start with is a Kegels exercise. And coming to the third benefit, that's the better sexual comfort or the better sexual satisfaction by herself and by her partner. So what happens when we are doing a Kegels exercise? It not only tightens the muscle but also increases the neurovascular supply, that is nerve supply and the blood supply. So when the blood supply increases, there is a lot of rejuvenation happening. So vaginal rejuvenation happens plus the better sensation of that area. So in that way, there is a better sexual satisfaction and the partner satisfaction is also much appreciated. So now coming to how to do Kegels exercise, that's the important thing and the difficult part of it, because it's very difficult to train or show a pelvic muscle exercise, but you have to understand that pelvic exercise is one which you're contracting that particular muscle. So identifying that muscle, that's a way how you control urination or control defecation or passing stools. So these are the same muscles which you're supposed to pull in and hold it and relax. So how you exactly do a Kegels is lie down in a supine position looking up straight, where that's when your pelvic muscles are at lax. So that's when you pull, identify those muscles and pull in for 5 seconds, hold it for 5 seconds and then relax for 5 seconds. It should not be fast, neither it should be very slow. So pulling in, holding and relaxing has equal importance in a Kegels exercise. And the number of times you do a Kegel exercise is also very important. Okay, you can do these Kegels exercise in 3 or 5 sets. Sets meaning that is one set will include 10 Kegels. So and you can do that as 5 or 3 sets depending on your prevention of urinary incontinence or treatment of urinary incontinence. So if you're not able to do Kegels exercise these many sets in a day, electromagnetic chair can help you out. Focused electromagnetic chair is nothing but electromagnetic waves which is targeting the perineal muscles and giving a contraction to your muscles which is supramaximal than your Kegels. So you just have to sit on the chair and that electromagnetic waves will target your perineal muscles and it will contract and relax your muscles much more supramaximally or much more efficiently than a normal Kegels. So that is much more effective in treatment of stress urinary incontinence also. So basically this chair is kind of a machine where you'll have to sit on it without undressing. You can wear on your clothes and just relax and sit on it. Your doctor will guide you on how to go about the procedure. Sit on it for 28 to 30 minutes and it will almost give you a supramaximal contraction of 11,000, which is equal to 11,000 Kegels, and that helps in perineal muscle tightening. So who all should do the Kegels exercise? Kegels exercise is something which every girl can start doing as soon as she learns Kegels exercise. There is no age limit for gymming, right? So same way there is no age or particular time when you have to start doing Kegels. Do it as early as possible for your better perineal muscle health. For more such informative videos, do subscribe to us.